I'm just trying to get everything here correct and at home correct. So, it's stress.
Yeah. Well, I want you to know there's a lot of support here and ways that we can help you with HonorHealth. So what are some of the day-to-day challenges that you face at work?
Yeah, I would say I think time management was a big one, especially starting off.
Our healthcare workers are facing a lot of stressors. They're dealing with family, whether it's children at home or elderly parents that they may be taking care of. They have some of the same other financial stressors that everybody else in the community does. What this crisis fund does is it helps to support our caregivers in a time of need, something that comes up unexpectedly, an unexpected bill, a healthcare problem. It really could be anything that becomes a crisis for our employee at that time.
Chris is a 2-time breast cancer survivor, and so she gets an illness every 12 months to 18 months. And we thought she was going to die. It was that serious, and the hospital saved her.
My illness hits me very, very quickly, and it happens within an hour, and it's very scary. But when I'm on my way to the hospital, I start to relax and I start to feel safe. And the word safe when you feel unwell is huge, because you know that you're going to be looked after, you know that you're going to be okay.
That was my introduction to HonorHealth, and when someone does something nice for me, I'll never forget it. We decided that we had to do a financial commitment for the organization, and we didn't want it to go into a general fund.
Hi, my name is Paula. I'm a pharmacy
medication reconciliation tech for HonorHealth. For the last 2 years, my family has been in crisis. We lost our oldest son suddenly in 2021. Last year, my husband's chronic liver disease worsened rapidly, landing him in the hospital for weeks at a time. I have been the sole breadwinner for our family of 5. It's been hard. With only one income and the increasing expenses, it got to the point where
there was nothing left to pull from. We started falling behind on payments. In August, my husband's condition turned critical. His doctors told us that he needed a transplant or he would die within just a few months.
I have really leaned on my HonorHealth family. They've been incredibly supportive. Sometimes I have to step away and just cry for a moment, but I inherited a strong work ethic from my dad, and I try to model that for my kids. I was told HonorHealth has a grant program for employees facing crisis. When the funding arrived, I was so relieved. Without it, my kids wouldn't have a roof over their heads. In October, my husband finally got his new liver.
So thank you, Mr. and Mrs. Watson, for creating this endowment. There are a lot of other HonorHealth families struggling too, and you are making a big difference for the HonorHealth family. You have helped us live our values. Sincerely, Paula M.
These are the unsung heroes, and our Healthcare Heroes Fund is designed for all of them, because we want every nurse to feel and every employee to feel that there is an opportunity to get care and help.
And you see somebody in front of you and you have no idea what's going on behind. And just because somebody is smiling and looks good, it doesn't mean to say they necessarily are.
Philanthropy is critical for our society.
The financial constraints that hospital systems are facing across the nation is profound. The reimbursement is not enough to cover all that we would like to do in order to provide the best for our community. So the importance of the philanthropy of our generous benefactors in the community is really what sets HonorHealth apart and helps us to provide the excellent care here for all of our patients.